Hello, and welcome back to another episode of the 2020 podcast, Canada's #1 optometry podcast. I am your host, Dr. Harbir Sayan. Thank you so much for taking the time to join me here. As always, taking the time out of your busy schedule to join me here to learn and to grow. I really appreciate it. As always, right off the top, I have a big request. If you can, please do share this. If you get any value out of this episode, send it to a friend, send a link, put it on LinkedIn, take a screenshot, put it on Instagram, and tag us, and let everybody know that we are having this conversation. If you're watching, you will see that this is not me in my home studio. This is me and my wonderful friend, Dr. Janice Luk, at the BC Doctors of Optometry conference in downtown Vancouver. One of my favorite places, my favorite conference. Always so happy to be here. The energy is always amazing, and I get to sit down with such amazing people. Dr. Janice Luk is a graduate of University of Waterloo in 2016. She is the newly appointed BCDO board member and the recently crowned 2024 Young Optometrist of the Year. Please welcome Dr. Janice Luk. Thank you so much for being here, Janice. Appreciate it.
Thank you so much, Dr. Sayan, for having me. Honestly,
awesome.
So grateful.
I'm so happy to have you on. Okay, we want to have some conversations around Young ODs. You just won the award for Young OD of the Year. So we want to talk about Young OD life, okay, and career choices and how decisions that you've made or things that we can do to propel our career forward and have a better experience, more fulfilling, all these things, okay? I feel like I'm kind of the old man shouting in the camera sometimes about, come on, you got to do this or do that. Now, we're going to have an amazing, successful young optometrist here to share your journey. I think it's really going to help connect with some of our colleagues out there who want to have a more fulfilling career. So, first of all, tell us a little bit about you and where you practice, and then we'll kind of dive into that.
Sounds good. So first, I don't think I'm a young OD, to be honest. I graduated
Well,
in 2016,
you got the award, so somehow something...
Fair. I'll take it, but regardless, I practice right now in Vancouver. So I'm at two practices, private practice. One is in North Vancouver, so Hollyburn, and the other is in Mount Pleasant, and both of them are actually multi-doctor practices, so I feel very grateful. They all have specialty clinics, so I get to practice things that I love, like dry eye and aesthetics.
Love that. That's awesome. So, again, we're going to kind of talk about the arc of a young OD's career and making some decisions early on that can help improve that arc or the trajectory that a person may be on. One of the big ones is choosing where to work. And, I know, of course, new grads and young ODs are coming out of school with debt, and that is a big factor in decision-making. Tell me what went into your decision-making as far as the clinics that you work at, because, again, they're two big, busy practices that allow you to kind of push your boundaries, test out your skill set, and grow. Tell me how you chose to work in a practice like that versus other potential modalities.
For sure. So first off, I was really privileged that I went to school in Waterloo, so my debt level was actually a little bit lower, in all honesty. However, when it comes to practices, values are super important. And for me, finding a mentor at every practice that I worked at was one of my #1 goals. And it took precedence over anything else. And the reason why is because when you meet the right people at the right time and they foster their time into you and your growth, that's how you become better as a clinician and better as a person.
So tell me, okay, that's definitely talking about mentors. I think that's a very important part of this conversation. Let's go into that then. How does one go about developing that relationship with another person, a mentor relationship that you have developed with multiple colleagues?
Yeah, I've been very privileged. I literally just ask. I think one of the key things is not to be afraid to ask questions or to approach people.
Yeah.
The worst that can happen is that they'll say no, but then your skin gets a little bit thicker every time.
That's true.
It's good.
So what, in what sense? You ask, like, do you go up to somebody and say, could you be my mentor? Or are we talking about like, hey, I have a question about such and such. Would you mind giving me some advice?
Exactly. So I like to ask questions that I would get more of an elaborate answer from. For me, because I have interest in dry eye, I would approach different people in the dry eye space and ask specific questions related to that. Right. That would foster a conversation, and then you can deep dive, get to know the person too. So even when you're looking for a mentor, it's not like you're just looking for it from a professional level. You want to get to know them and get to know their families and things like that too. Yeah. So the person feels heard. So it's not always just about the professional relationship. I really believe in fostering relationships with people at a human level.
Right. And it also then doesn't seem like it's a transactional thing, right? 100%. So I think sometimes for the person who would be the mentor in the relationship, it could feel a bit one way in that they're just providing information to the mentee. And while that has some satisfaction and gratification in it, there should be a more open and two-way type of interaction, I feel like. And one of the things that somebody told me a little while ago that I thought was really valuable when it comes to that kind of relationship as the mentee approaching the mentor or the potential mentor is to have very specific goals and questions that you would like to achieve from that interaction, the first interaction or the earlier interactions, versus like, oh, hey, you're successful. Can you help me become successful? Right? It's like you said, you did your research and you found somebody who's expert in dry eye, and you probably went to them with that questions, and you were, educated on the topic yourself. So you weren't just going and be like, tell me about dry eye. It was, they could see that there's value in helping you get to the next level from where you are. So I think that was really great advice. So having that kind of specific question to ask and a goal even from that relationship that you're looking for.
Sure, we're not here to waste anyone's time. So
yeah, you don't want to, exactly. And I think that's what sometimes from the mentor perspective is that they don't want to spend time on something that's going to end up being, not worthwhile for them in some ways. And I don't want to make it look like the mentor has to get something out of the relationship, but I think it's important that you do that.
Yeah, because everyone has a finite number of hours in a day, and especially when you're at that level of quote-unquote success, those hours are quite limited, and you got to put it into certain buckets that you think are going to be fruitful. So
absolutely. So you kind of found some people who you felt like could support you in your career. You develop a relationship. They became mentors in a sense. And then how did you choose like the type of modality you wanted to practice in? How was that decision made versus, private practice versus a corporate setting versus a sublease setting, these types of things? Did you make these decisions? Was it predetermined for you already that you knew where you wanted to work?
Not at all. So when I actually graduated, I worked for 8 months at a lens crafters, but I found out very early on that it wasn't my style of practicing. I don't think I liked being told exactly what I had to do. I didn't like being told I had to make a sale or push an OCT or certain things like that. So that just geared me back towards primary care or private practice, just because there's more autonomy to make decisions in those specific practice modalities, which is very huge for me because I believe that in order for a profession to grow, we have to be able to make our own decisions moving forward.
Absolutely. I very much agree with that. I think one of the other things, like being in a private practice setting, and not to put down other modalities or settings, but in a setting like that, you can kind of flex your various optometry muscles, right? Or you can train them. And there's a term that I've personally been like trying to, use a little bit more as far as being an optometrist, being multidimensional, right? Versus one-dimensional, I guess. Just spinning dials, just spitting out prescriptions, just selling glasses. Being multidimensional and getting into dry eye, getting into myopia management, BV, whatever it might be. And maybe not even becoming the expert in something, but just knowing you have the skill set and all those things that if somebody walks through the door, you could help that person, right? You know what could potentially be going on. You have the time to help that person, right? Like you have the autonomy to take care of it. Whereas in other settings, you may be like, this is not what we do here, right? I just got to spit out prescriptions. And I think that's really important, like you said, for the overall growth of the profession, not just for individual growth, but the overall profession of optometry to grow in the long term. The more of us can take that multidimensional approach and make the choices that like you're making, I think that will be very valuable for all of us. So what's an average day? Like you work at, the two offices, you're at Mount Pleasant and Hollyburn, right? Both busy practices, both private practices. What's an average day in either of those practices look like for you? How many patients are you seeing? What's the typical kind of patient that you're seeing?
I would say the day usually ranges about 12 to 15 patients. Generally, primary care exams are number one. We do dry eye consults as well as dry eye treatments. So some of the days they're scattered or sprinkled with expressions and all that fun stuff post their treatments. So that's always the fun part of my day.
Yeah.
But otherwise, it's pretty routine, and I love that I can get to spend the time with patients, exactly as you said earlier, just because that's when ultimately our profession is healthcare, so we are in it for patient care, and to have that time to sit down and have conversations, get to know our patients is huge for me, which is another reason why I primarily enjoy primary care or private care practice.
Yeah, I love that. Let's switch gears a little bit. Newly appointed BCDO board member. Okay. I'm really happy to see that because it's amazing to have, young, energetic people who have the professions, thinking about the betterment of the profession, right? And having people like that in the position of the board to make decisions to direct our profession the right way. First of all, congratulations on being appointed to the board. What made you want to run to be a board member?
Fair. So a lot of reasons actually, but I wanted to give back to a profession that's given me so much. So even when I was practicing in Ontario, I really did want to be a part of the board back then too, but I didn't feel like I had much to give. Even now, I feel like it's a learning process every day. I definitely have a huge learning curve to fill this role in these shoes. However, if we all just spin dials and go to work every day and go home every day, no one is fostering the growth of the profession. And we do need people to step into these roles. And I have an interest in making sure that hopefully my little bit of time on the board will be able to make some sort of positive impact.
Yeah. Maybe it's a lot of time.
We'll see.
Yes. You just get reelected and stay on the board. I think that'll be good. What other values? So obviously, yes, I appreciate that, giving back to the profession. You've just become part of the board, but before that, you were still involved in attending. Tell me what you think the value is in attending, just being involved in your association, wherever you are, whichever province or state you might be in. What value has that brought for you?
A lot of different values in attending conferences, just because it's not just a networking. So our profession, as many optometrists and ophthalmologists as there are, it's still a very small network of people at the end of the day. So when you go to these conferences, yes, you do see familiar faces and you get to make more relationships.
Yeah.
And there's that rule that you are, I guess, the average of the 5 people you spend the most time with. So I'm very grateful that by going to these places and meeting all these people, you get to pick different people's brains and learn so much more, not just about the profession, but about life in general. So it helps you grow as an optometrist and as a human being as well.
I love that.
I love going to different places, and you get to travel for work.
There you go. That's always nice too. Mm-hmm. I mean, I don't travel that much, but I can imagine it would be nice.
Oh, please, you travel lots.
All right. But you know what? I would agree with you on all of that. So I've been involved to some degree, small degree, with the BCDO since day one, and always attending conferences. And I give a lot of credit to a lot of the opportunities that come to me in my career actually have been through just being around.
Agreed.
Right? It's like you said, the average of the 5 people, but expand that. It's the average of like 100 people you see the most in your kind of day-to-day life or in your career. And if you make those good people and people who are all kind of working to make the profession better, it's going to help you be better as well. And once in a while, because those are all good people, they'll be like, hey, Janice, you seem really good for this role. We have an opportunity. Here you go. Like, be on TV or be on the radio, or maybe it's a work opportunity, or maybe it's whatever it might be. But like different opportunities will start to come up once you start spending time around those people. And I feel like that's been huge, valuable for me as well.
100%.
So tell me about what you're doing outside of the office. You're doing a lot of fun stuff. You're really into beauty. What's the right term? Dry eye, beauty trends, eye health related stuff.
For sure.
Tell me about some of the stuff that you're doing, whether it's social media, speaking, there's other sort of partnerships and stuff that you're involved with. Tell me a little bit about that.
Sure. So number one is social media, I guess. I got into that during the pandemic, and it was just a little fun passion project, not even. I was just like, oh, we'll see what happens. And I wasn't that invested at first. But then the interesting thing about social media, and you know this 100% for sure, is that you get to foster more networking. And it's at a degree that you don't get to do on just a level that you're seeing someone. You get to talk to people all over the world, quite literally. And these people are people you might not necessarily be able to approach in day-to-day life. So it's amazing what social media has brought in terms of career opportunities. It's almost like an online resume in today's society. So whether it's speaking engagements or other types of opportunities that have blossomed, I really think Instagram and other social media networks that have allowed that to happen.
Yeah, I love that. So what else outside of social media?
Mm-hmm. So I have a big focus on beauty trends and their effect on eyes, specifically dry eye, I guess. So right now I'm working with the American Lash Association.
Wow.
And that was also fostered through Instagram as well. So you just start talking to a ton of lash artists. And then there's this great organization. I went to LashCon, which is the biggest one in the States. It's a huge conference specifically for lash extensions.
That's crazy.
It's really cool. So I was the only optometrist there, and they're like, what are you doing here? But the cool thing is that we spend so much time around a patient's eye and their eye health. But the problem is we don't know how to properly educate necessarily patients on all these beauty trends. And by going to these conferences and immersing yourself in things that are not necessarily in your alley, you get to learn their aspect and how they're doing things. And then you can then learn their profession and then integrate it with your own.
Yeah. How incredible is that? So through social media, you connected with the lash artists and people in that world, and now attend their big conference down in the States.
Yep.
And you're starting to work with them in that capacity to try to help educate, which is what we should do. I think many of us and our colleagues probably don't want to deal with that, and we just tell our patients you shouldn't get lash extensions. But really, like, that's not going away. Good luck with like telling somebody don't get lash extensions ever in your life. Like, I think the better approach is like education
100%.
of not just of our patients but the lash artists, right? Because then the education is given to ideally all of their customers. It's very cool that you're doing that.
Thank you.
Any words of advice on that front for colleagues of ours who are seeing? I asked Claudine Curry this kind of question a little while back too. But like, let's say I have a patient in my chair. I don't know much about lash extensions other than what I see in the slit lamp. Like, what am I saying to that person about like making sure they're taking care of their lashes and reducing the risk for eye health issues?
Well, specifically to lash extensions, the number one thing that always comes about is the blepharitis or the buildup, just because your patients are spending so much money on their lash extensions. They're trying to be really mindful not to make any fall off, but educating them on the importance of cleaning their lashes, and if they have any complications, first of all, to come in, or if their eyes feel irritated, to come in as well, and taking breaks. So one thing I do with patients who are married to their lash extensions is I actually bring them in for microblepharal exfoliation between their fills. Between their fills, I always recommend they come in for microblepharal exfoliation or some kind of in-office treatment. That way they can we're trying to create an environment where they can still safely do their lashes. However, they're doing it in the best way that they can protect their eye health at the same time.
Got it. Very good. Okay, so we got to get more comfortable with not nagging our patients to stop wearing eyelash extensions, but more kind of meet them where they are, empathize with them a little bit if we can, right? And educate them and provide them with options that will help them wear their lashes in a more healthy way.
Agreed.
So I love all of the different stuff that you're doing. Again, multidimensional. I was talking about that in practice, but I think we can be multidimensional outside of practice too, or in our career as a whole, right? Yes, we're optometrists. Yes, we see patients in clinic, but there's so many other things that we can do outside of clinic. And I really wanted to make sure that we shared that message with our friends out there. Whether there's, you're a student or you're a new grad or you've been practicing for a while, there's a lot of stuff out there. We're really lucky to work in a profession where you can bring your passion or some hobby that you love into your career, maybe even into your practice at work. But like, tell me a little bit about when did you decide that you wanted to kind of pursue these, and how did you start to bring these different passions into your career?
For sure. So to your point exactly, optometry is such a cool profession because it's almost like a launch pad. Yes, you can be someone who just goes to clinic and goes home every day, but if you want, there are just so many avenues, whether it's your glasses, contacts, beauty trends, or social media, speaking and engagements, things like that. There's literally the world is your oyster. So you just got to find an interest that you have and then dabble a little bit more into everything and then see where, I guess, the road takes you. So don't just feel like your career is just what was told to you in school. There is just so much out there with every profession, but with optometry specifically, I feel like there's just endless opportunities that are there.
I definitely agree. I feel like right now specifically is a time where like a lot of stuff is sprouting.
It's
and
crazy.
And now is a time where you can take like if you got a bit of an entrepreneurial spirit or you got something else, and you can start to pave a whole new path, in fact, that somebody else has never done before, start a new business within the industry. So you're kind of blending your training and your education in optometry with some other passion that you have. So what other advice do you have for recent grads, new grads, to help them build a fulfilling career?
So I think number one is finding your values when you graduate, because that will actually help you find the job that you want to be in as well. So revisiting core values and making sure the people you work with or work for are aligned with your values, because that changes how happy you are coming home from work. Sometimes the disconnect could just simply be that we're just not on the same page, and that's completely okay. So then you find someone who is on the same page with you and then improve not only your work happiness, but your life happiness as well.
Absolutely. I think that's so important, like who you surround yourself with and the environment that you put yourself in is so important. And making sure that your work, the career decisions align with your values. I think that's where a lot of when people are not happy with their career or their path or just life in general is just there's not an alignment in that, right? I'm doing something that doesn't align with my authentic self. So understanding what your values are and making choices based on those values, I think that's a great piece of advice. So Janice, I'm going to go back to, I started changing up the podcast a little bit and asking some different questions.
Okay. Oh no.
At the end.
Oh no.
Okay. We're gonna do a little mishmash of some of the different questions that I asked. First, we're gonna do a quick little rapid fire, short answer, one question to one sentence type of deal.
Okay.
Just whatever kind of comes off, the first thing that comes out to the top of your mind, and then we'll ask a couple of some of the questions that I've asked a lot of guests in the past because I feel like those kind of are a bit insightful. So, number one, let's do the rapid fire first. Okay, so here we go. You ready?
As ready as I'll be.
Do some breathing exercises. Here we go. Okay. Rapid fire. What gives you energy? Speaking of getting pumped up and doing
getting pumped up. So I like running. So even this morning, actually, I got up and I was so tired, but I'm like going for a quick, even 10-minute run gives me my energy. And I get a lot that I'm very passionate about what I do. And that's the thing is like, if I don't like doing something, why are we doing it?
Yeah.
We literally don't have that much time in the world. So if you think that you really enjoy doing one thing, just put all your energy into it. That's
Love it. Love it. So running is something that gives you energy. Yes. I know there's a lot of people out there who are going to say running drains their energy, but I'm with you on the energy and the gives you energy side of things. So actually, that's the next question. What drains your energy?
I guess
nothing. Apparently, Janice is unlimited energy.
That's not true. I guess sometimes surrounding yourself with people who maybe don't share the same values as you does get a little bit, I would say, draining sometimes. So
it's funny, I've asked this question to a lot of people, and that answer to that question, what drains your energy? The majority of the answer is people, other people, and it's not like, oh my God, I hate people, but like other people, and it's true. People can be a bit of an energy drain or sap if they're, if things again are not aligned and you're not the right type of people. Okay, what would you do if money was no object? What would you do with your day, with your life?
Probably go snowboarding and hiking all day, every day.
Snowboarding, hiking every day. Love it. Okay, great. And what is an activity that brings you into your flow state? So something that you do where time sort of fades away.
Definitely running and snowboarding. Again. Those are literally the top two.
Love it.
Reading too.
And reading. Got it. All right, but I want to bring these to you. Okay. So number one is if we were to hop in a time machine and go back to a point in your life, career, that you were struggling or unhappy or something wasn't going well, you're welcome to share that if you want, but more importantly, what advice would you give to younger Janice at that time?
Advice would be to zoom out.
Zoom out.
Reason being is we are so focused on our problems and we don't realize that we are the root of our problems. Like everything that we think is a problem is self-created. So being able to just take a step back and breathe and zoom out, that's the advice I'd give myself. I was so hyper-focused into one problem that I didn't realize it wasn't even a problem.
Right. Look at the bigger picture. I think that's actually really good advice. Really good advice. And the final question is, everything that you've achieved to this point in your life and your career, how much of it would you say is due to luck and how much is due to hard work?
I would actually say 50-50.
50-50.
Yes. So hard work is necessary. I believe a lot in grit and just showing up when you're supposed to show up and doing the things you're supposed to do and going beyond that. However, I also believe in luck. Meeting the right people at the right time in the right place to then foster everything that's grows out of it. I'm always so grateful to all the mentors and people I've been lucky to surround myself with and have the opportunity to learn from. And that's why I am here today. So any opportunity, same with the board and other things, I just want to give back. And I believe it's full circle. Because if we don't do it, then the cycle ends.
Yeah, that's amazing. Thank you very much. Final words of wisdom before we wrap up. Janice, anything you want to share?
I am so grateful to be here because I've been listening to this podcast probably since the beginning. And I was like, oh, maybe one day I'll be on here. And here we are.
Look at this. So, in 2 days, not only do you were elected to the board, crowned the new Young OD, and you're on the 2020 podcast. That's a pretty big weekend.
I feel very humbled and I'm still on cloud 9 right now.
Thank you. Well, I appreciate you coming on, Janice. I've been wanting to have you on for a little while. Obviously, we've been chatting and we're friends, but I've been watching you grow and really, it's amazing. I feel like you have really taken on a new trajectory with all the stuff that you're doing. And this is what I want to share with everybody who's watching and listening is all these things are possible for all of our colleagues. I've been watching and really been admiring the trajectory that you've been on. Honestly, it's amazing. And I feel like recently it's really starting to take off. Speaking so much more at different events, traveling for speaking opportunities, working with industry, all the stuff that you're doing. It's amazing. And I really want to share that with our listeners and the viewers because it's something that we could all be doing to really enjoy our lives more, have a more fulfilling career. So thank you for coming on. Thank you for everything you're doing. And I hope you keep growing and I want to see more and more of what you do. And I hope that people out there who are watching and listening will also do the same with their careers. So thank you for being here.
And just keep growing because I'm learning every day.
It's great. And thank you everybody for watching and listening to the 2020 podcast, Canada's #1 optometry podcast. I will see you guys in the next episode.